Well, if your doctor has recommended treatment for an autoimmune or inflammatory disease, you may need infusion therapy in a specialized center. Arise Infusion has 5 state-of-the-art centers right here in the D.C. metropolitan area with highly trained staff who provide safe, comfortable administration of the most advanced medications. Arise Infusion has been providing convenient and cost-effective infusion therapy care for over 10 years. Joining us today to tell us more is Dr. Ashley D. Beall and Monisha Sharma, registered RN. Hi.
Hello.
I should say an RN.
Yes.
Right? That's what the R stands for, is registered.
That's right.
So welcome, ladies. We are happy to see you guys.
Thanks for having us.
So tell me a little bit about Arise Infusion Therapy. The patients come and they get medication, they get treatments for a variety of diseases. What are some of those diseases that you treat?
Yeah, so Arise Infusion Therapy Services specializes in the treatment of inflammatory conditions and osteoporosis.
Okay.
So some common common conditions that you may have heard of are things like asthma, inflammatory bowel disease like Crohn's or ulcerative colitis, autoimmune neurologic conditions like multiple sclerosis, inflammatory dermatologic conditions like psoriasis, and also arthritis as well, things like rheumatoid arthritis and lupus.
Oh my goodness, and those are something that a lot of people have, unfortunately.
Right, lots of people have these types of conditions, yeah.
So if an individual has asthma, for example, how does that process for the treatment, how does that happen?
Well, so if a patient has asthma that's failed to respond to standard therapies, his or her physician will potentially prescribe a medication called a Biologic, which is an advanced medication that controls part of the immune system. So we receive the order from the patient's referring physician, and one of our pre-authorization specialists will confirm coverage with the patient's insurance company. And following that, a consultation appointment with one of our infusion specialists, one of our physicians will be arranged, and a history and physical exam will be performed. And if there are any questions about the medication or any concerns that the patient may have, then those can be addressed at that time. And right after that, they can get their first dose of medication.
How long does it typically take once you've done, say, the paperwork and you're treating somebody? How many treatments does it typically take?
So it depends. I mean, there are different types of conditions that we treat. Some of them you only need a medication once a year. Sometimes you need a medication as much as once a month. So, and when you're on these medications, excuse me, sometimes people respond very quickly, and sometimes it takes more time.
So it's the individual.
It's very individualized. Yeah.
Okay. All right. Well, Dr. Beall, Arise Infusion has multiple locations, as we said, all over D.C. What are the advantages of getting the treatments at Arise?
Well, I think the biggest advantage is our caring and compassionate staff. We have Monisha here, and she's one of our nurses that's been with us for over 10 years. But every patient that comes to us, we try to make sure that they have a positive experience. We put their safety and their comfort first, which is really important to patients when they come to see a physician.
Especially if they have some of these other diseases that are causing such pain.
Absolutely. And you know, generally getting a treatment with us is less expensive than getting it at a hospital-based facility, which is really important for patients.
Absolutely.
You know? And our prior authorization specialists make sure that any co-payment assistance that we can get for patients is obtained. So it's just we try to make it a welcoming experience for everyone that comes to see us.
And that's good to know. So how does biologic treatments make a difference in the patient's quality of life?
Well, biologic therapies over the last 10 years have taken millions of patients who previously would have been, as you said, disabled or in chronic pain, and they have given them a new outlook on life. And so as a physician who's been treating these patients, I can tell you that patients who previously were unable to do many things that they wanted to do with their family or be fully productive at work have actually been able to do that. So it's been very gratifying to treat these people.
Absolutely, and to see them get like a second chance at life.
Absolutely, that's how they feel.
Yeah. That's nice. All right, Monisha, we're not going to let you off the hook. All right, so you're the clinical director at Arise Infusion, and I want to know about a typical experience one would have as a patient.
So we offer a friendly and professional experience at Arise. We have a highly competent staff, very compassionate, caring, been with us for years. We actually have a very low turnover, high retention rate with our nurses at all of our facilities. With that said, a typical patient would come in, would be greeted by one of our nurses, and then assessed to make sure the patient is well, in good condition, have all their questions answered before they go for treatment. This treatment could be a subcutaneous shot or an IV infusion, just depending on what they're there for. And with that said, these patients can be there for 30 minutes or up to 5 hours. So we try to keep it very comfortable for them. We have pillows and blankets, snacks, coffee, Wi-Fi, the little things that makes the time go by faster.
Right.
And with these patients coming back once a month or once a year, you build a relationship with these patients, so they quickly become like family, and you see their progress, how well they're doing. So it's very rewarding, and it's nice to see how they're doing from time to time.
And it's nice that they have that relationship with you, because it is still scary, even as an adult. It's still scary to have to go to the doctor.
No, absolutely.
So if they get to see the same person or the same doctor, the same nurse all the time, it does put them at ease. So there's a new therapy medication for multiple sclerosis. Can you tell me a little bit more about that?
Oh yes, so this has been a revolutionary breakthrough, excuse me, for patients with multiple sclerosis. It's a medicine called ocrelizumab or Ocrevus, and this is the first medication that's been approved for primary progressive multiple sclerosis. Previously, there were no FDA-approved medications for this condition, and it has also been approved for relapsing and remitting multiple sclerosis as well. So patients who have this disabling condition, they have a brand new medication that may be able to put their disease, to prevent their disease from progressing or help them get function back.
Oh, wow.
Yeah.
That is a huge step in the right direction.
It's a huge breakthrough. It's been really important. It just came up. It was just approved in May of this year, and we've been infusing since June, and we've treated multiple patients with this medication.
Wow. All right. We could talk to you more, because this is just very invigorating. But where can we go for more information? Where can we find you guys?
Well, so you can go to our website at ariseinfusion.com, and on that website you will see we've got all of our forms and our processes are on there, as well as the phone number to contact us.
Okay. Well, gosh, thank you, Dr. Beall. Thank you, Monisha. We are so happy that you're here. Thank you, guys. All right, stay with us. We have more of Let's Talk Live coming up right after the break.
The